Here at the Pacific Eye Clinic, it's important that we do vision exams on young children and infants. When you go to the pediatrician and they check vision for 20/20 and maybe take a look in the back of the eye, they're not looking for all of these other things that we did in this exam. We look at visual function as a whole. For a child to succeed in life and succeed in school, we want to look at the whole visual system. So it's important to bring the child in for these vision exams.
One common misconception about vision is that vision really is all about the eyes. And while the eyes are definitely important, they're the first step in the process, really vision happens in the brain. When we evaluate a young child, we're not only evaluating how healthy their eyes are and how good an image the eye forms, we're evaluating how much they're able actually to process and interpret what they see. As a baby grows and develops, if they have good eyes, those eyes will provide a good image to the brain, and the brain learns over time, the child learns how to process that information at a higher and higher level. But if they're born, for instance, with one eye that's weak, or an eye that's cloudy because of a cataract, that eye will literally be left out of the brain's wiring as the brain develops, because the brain will ignore that eye because it doesn't make sense to use a bad eye. That's really why we want to see babies early, so that when we do make that change in vision, that now normal wiring can occur over time.
Parents should be starting to think about bringing their children in for eye exams around 6 months to a year, and that should be the initial visit. Then they should be bringing their children in around 3 years old, and then another time specifically before their kids start going into school. That way we can help get their children ready to be learning at their optimal level when they start.
Just looking to make sure her eyes move everywhere they need to.